Chronic disease is what we're seeing so much more of these days. Basically, everything is going through the roof. It's skyrocketing. Autism, ADHD, diabetes, allergies, autoimmune conditions. Half of all kids are obese or overweight. In California, 1 in 22 kids have autism. It's like, why are we not learning about nutrition? Why are we not learning about exercise? Why are we not focusing on the root cause? Why is it all about treatment? Your body is amazing. But if we're not giving it the things that it needs, how do we expect it to function?
Hi guys, good morning and welcome back to another episode of Biohack-it. And since I'm talking about IVF fertility, we can't leave out children. So I searched very, very hard and long to find a guest in this category, and I got very lucky that there's somebody I really wanted to meet who's based in Los Angeles. Dr. Gator Warsh, I'm so excited to have you on today, is a leading integrative pediatrician based in Los Angeles, celebrated for his expertise in holistic child health, which is a very rare thing these days. So I'm really excited to bring you on to the podcast and talk to you about children's health, vaccines, and all the things that are not keeping children safe these days. So thank you for coming on Biohack-it.
Thank you for having me on. I'm excited to chat.
I wanted to understand a little bit more about how you got started. So you started, do you start as a traditional pediatrician that then went a little bit more holistic? How did the shift happen?
So I definitely started more traditionally. I think most people that get in integrative medicine have some sort of life health complication where they go through the system and it doesn't really help them, and then they go outside of the system and get better. That really wasn't the path for me. For me, it was really going through residency, giving out medications like candy, seeing people go outside of the medical system and get better, and also meeting my now wife at that time, who was very holistic minded as well, and just being open to learning about it and starting to do some courses and see how effective it was. And then as you start to learn about it, you're like, of course this makes sense. Like, why are we not learning about nutrition? Why are we not learning about exercise? Why are we not focusing on the root cause? Why is it all about treatment? I mean, treatment's great, it's important, but it's obviously not everything. And that's all that we learn about in med school. And so you really, once you get down that path, it opens up your eyes and you can't go back. And I think integrative medicine gets a really weird rap. Sometimes it's like woo-woo and out there, but it doesn't have to be. I mean, I'm certainly not woo-woo or out there. I used to play sports and do all sorts of normal things and didn't eat that healthy, but I learned about health. I learned about wellness. And of course we should think about our diet. Of course we should think about these things.
And so, like, for example, the children that are coming in and that you're seeing, especially in the last, let's say, decade, right? What are some of the common health issues you're seeing that you didn't see previously before, and why are those coming up?
So chronic disease is what we're seeing so much more of these days. It's insane. I mean, if you look at the statistics, basically everything is going through the roof. It's skyrocketing. Autism, ADHD, diabetes, allergies, autoimmune conditions. I mean, diabetes, I think, is maybe the best example. Type 2 diabetes is literally called adult onset diabetes, right? It was because you really didn't see it in your career as a pediatrician. And now the average age of onset is 13 for diabetes. About a third of kids have diabetes or pre-diabetes. That's insane numbers. Half of all kids are obese or overweight. In California, 1 in 22 kids have autism, 1 in 36 nationally. And if you look back just a couple of decades ago, it was like 1 in 25,000, 1 in 1,000, 1 in 150. Then now it's 1 in 36 or whatever the number is now. And yes, we're a little better at diagnosing it. Yes, we're a little more aware of it. So that's for sure true. But there's no way that is what's going on. I mean, that's just such a small part of it.
Right.
What's going on is that our kids are sick and they should not be.
And are you seeing a lot of that down to, one, I know, and I've heard, I'm not the expert, you are, but that the spectrum that ADHD and autism is so wide, and sometimes kids get put in that category because sometimes traditional pediatricians and all, or, primary cares don't know where to place the kids. So they just lump into this large spectrum that is literally a spectrum. And the other thing is, a lot of these doctors, which are a bit more like yourself, integrative or functional pediatricians and stuff, are saying that it is sometimes something to do with the gut. It's toxin levels, mold exposure, or not enough mineral balance. It's the gut-brain connection that's dysregulated.
Well, a couple of points there, because I think you made some great ones. First of all, it's way overdiagnosed, especially when talking about ADHD. There's just such a quick kind of like automatic diagnosis. Oh, my kid has a little bit of misbehavior in school. Okay, let's call him ADHD. Let's give them a medication. Of course, sometimes that can be very useful for using a medication, but that should be a last resort, not a first resort. And so for something like ADHD, I think that's a big part of what we're seeing too is an overdiagnosis. But at the same time, it's certainly happening more because of our lifestyle and what's going on. Same thing with autism, exactly what you mentioned, that there isn't an exact easy test for diagnosis. So it's more of a clinical decision. You go see a practitioner, you answer some questions on a form, maybe they watch you for a couple hours, and then they say, okay, you have ADHD, okay, you have autism. And there's not an easy blood test like cystic fibrosis or something like that. So yes, we are more aware of it, we're getting more diagnosis, but at the same time, it's kind of a catch-all term, especially with autism. And I am positive that autism is many things. I think it's certainly genetic to some degree, but a lot of the discussion these days is around, oh, it's just happening more, it's just the genetics, it's just how it is, and that is not how it is. If you think about diabetes, again, it's a great example. We have type 1 and type 2. Type 2, very much a lifestyle disease, and we've known that for a while, and we're totally fine with that. Doctors will say, okay, you work on your diet, exercise more, maybe we can get rid of your type 2 diabetes. But that's not the way we think of every other condition. And I think that is the way that it is for so many things. I've seen patients get better by changing up their lifestyle. I've seen children who have a diagnosis of autism have their symptoms improve or go away to the point where they don't have that diagnosis anymore. Same thing with ADHD. Same thing with most of these conditions. Genetics plays a part. It certainly affects your likelihood of getting some of these things. Maybe it's totally genetic for some kids, but I think for a lot of kids, it is lifestyle. It's what we're doing. And if we make some changes, then we will see things change and improve. But that's a controversial thing to say, which it shouldn't be. There's no reason why we shouldn't be doing everything possible to help kids to do as well as they can, to be as resilient as they can. And if your child is functioning amazingly with an autism diagnosis, great, that's fine. But there are a lot of kids that aren't. There are a lot of families that are really struggling. There are a lot of kids that are nonverbal or hurting themselves, or it's really tough for the family, and those families are looking for support. And maybe there are some things that we can do instead of saying it's just genetics. Maybe we can help that family to improve some of those symptoms over time by taking back the power. And it seems like we're giving away our power over health, and we have to take it back. We have to remember that what we do matters.
Absolutely, especially when they come into this world and they start at such a young age, and they're so susceptible. Their microbiome is just being, kind of like built, and their immune systems are being built. And those early years, I think, matter more than ever because the level of toxins or food and everything you give them is forming them. Mm-hmm. So it can have such a direct impact directly on their health, much more maybe so than somebody who's already 40, 41, 50 years old, because they can move, I guess, correct themselves naturally a bit faster.
I mean, I don't know if we can. I think that we haven't lived in as toxic a world for so long, and we're a little bigger, and we have probably better detoxification systems as we're older that can handle things a little bit more. But also, most adults have a chronic condition too. So I just think that we're getting to the point where most people can't handle what they're being exposed to, and we're just not getting the nutrients that we need mixed with being exposed to too many chemicals, and that falls over a cliff at some point. And for each person, it's expressed as something different, whether that's a mental health condition, whether that's autism, ADHD, allergies, some immune deficiency, getting sick, whatever it is. Yeah. I think that's how it expresses, and that's what we're seeing. And yes, of course, there are some genetic conditions, and genetics plays a role, but that's not what's happening. We didn't go from 1 to 5% chronic disease to 50% chronic disease in kids in a couple of decades because we're just better at diagnosing it, or it's just genetics. Our genetics didn't change at all, or very little, in a couple of decades. So that's not what's going on. It's our environment. And if we had a fish in a bowl with a bunch of chemicals, we wouldn't assume that medication would make them better. We would clean the water. Right? And that's what's not going on. We don't have clean water that we're living in. We're living in a toxic world.
You know me, I'm always on the hunt for ways to level up my health game. And let me tell you, I've learned that when it comes to overall wellness, all roads lead to the gut. 70% of the human immune system resides in the gut, making it a crucial factor in overall health. That's why I'm thrilled to introduce to you our newest partner, Jonah, the most advanced microbiome company on the market. If you're like me, always looking at ways to optimize your health and well-being, you're going to love this product. Jonah isn't just another health app. It's a cutting-edge AI platform that analyzes your microbiome to unlock your body's full potential. Imagine having a personal health detective that dives deep into your gut to uncover the root cause of your symptoms. That's Jonah for you. They use state-of-the-art technology to get a comprehensive picture of your gut health. This isn't science fiction. It's a personalized model of your biology that helps predict how different factors affect your health. Personalized nutrition recommendations. Based on your unique microbiome profile, Jonah provides tailored dietary advice to optimize your health and enhance longevity. Whether you're aiming to boost your energy, improve your digestion, or simply feel your absolute best, Jonah is your new secret weapon. It's like having a team of microbiome scientists in your pocket working 24/7 to help you achieve your health goals. Ready to experience the precision of wellness? Visit Jonah, JONA.health today and start your journey towards optimal health. And I always talk about the role of environmental toxins that they're playing, in adult bodies, leave alone children's bodies. What are some of the, like, in your practice, some of the kids you're seeing, if you meet a child and you're like, this child has mold exposure or high environmental toxin load, what are some of the treatments you're putting them on or offering them?
It really depends on the child as well as the severity of the symptoms, because for me, in general, the first thing to do is just to have discussions, just to talk about our lifestyle, just to even acknowledge that the little decisions that we make add up. Of course, if the child's very sick, you might do more, but for most kids, it's really just discussing the nutrition, the exercise, the sleep, the toxins, and making parents realize that when they're buying something, they have to read the label. You got to think about all the things you're putting in your home and all the things you're putting in your children. And that, to me, is the best place to start, because ideally we don't give them a whole bunch of medications, do a very significant detox protocol on a 2-year-old. That's obviously not the best thing to do if we don't have to. And luckily, kids are so resilient that if we do kind of move in a little bit different path, their bodies can kind of refocus and rebalance. And we do see magical changes. But you have to go into it with appropriate expectations, because it's not a pill. It's not magic. It's not going to happen overnight. It takes months and years for things to slowly improve. And there was a great study on 2 autistic twins. I don't know if you saw the study from Documenting Hope. It was published a couple months ago now. Kids with high level autism, and they went through a protocol over 2 years, and they did a functional medicine protocol. They did all sorts of lab testing. They changed up their lifestyle. They changed up their diet. And over those 2 years, their symptoms vastly decreased to the point where they were below the threshold for even having the diagnosis of autism anymore, or low-level autism. And that, to me, is just so profound. Of course, it's just 2 kids. It's not a double-blind control trial over 10,000 kids. But the point is, if you work on things, it can improve. And lifestyle matters. And so you don't need to do a massive IV drip detoxification for most kids. You just have to buy healthier food, buy from a farmer's market, go outside for walks, get into nature. I mean, your body is amazing, but if we're not giving it the things that it needs, how do we expect it to function?
Right. I also had a guest on my podcast earlier, like a few months ago, Dr. Patrick Porter, and he talks about, because he studies like brain scans and he has a device that kind of measures that stuff. He spoke about how they're seeing like patients who come in with autism and they scan their brains before and after. And when they run the alpha brainwave device on them, their autism levels went down, because a lot of times kids are producing kids diagnosed with autism have low alpha brainwave activity, and it normally stems from nutrient deficiency from their diet.
I mean, how would nutrient deficiency not lead to brain concerns, right? It's part of our body. I mean, you need to feed it good stuff like we feed everything else. And if we didn't give our pets good food, they'd be sick. If we don't give ourselves good foods, we're going to be sick. And the vast majority of the calories that children are eating, like 70 to 90%, are ultra processed crap that has chemicals and dyes and preservatives, and it's not locally produced. A lot of kids, I think over 50%, don't have a veggie or a fruit on any given day. I mean, you look at what they're giving kids at school, the food that's offered here versus other countries, there's no chance that kids are going to be healthy. There's just no way. We forget that we're literally built of what we eat, and we changed our diet so drastically over the last few decades. And it's so easy to see. If you pick something off a tree, if you go to a farm or you have a little garden and you pick an apple or a berry, how long does it last? It lasts like 2, 3, maybe 4 days. You think the food in the grocery store, even in the best case scenario, was picked 2 or 3 days ago? No, they picked the banana, some other country, flown over here, picked early, they sprayed in a bunch of chemicals, they ripen it, you pick it, you eat it a couple of days later. I mean, that's better than eating something out of a box, but it's still not nutrient dense. Like what food used to be. So we're just not getting that. And as a dad, it's really interesting to see my older, he's 5 or almost 5 now, and you see him go to a party, and we eat very healthy, healthy-ish at home all the time, and we get a lot of like local produce and farmers markets, but you see him go to a party and have a couple of bites of cake, and he's a different child the rest of that day. His friends have a couple of bites of cake, also very healthy, get sick that same night and the next day, and like fevers, and they're going nuts, and they're super calm kids. And you're like, if that is the way that my child acts after eating a couple of bites of one piece of cake, it's not even that bad cake, and what is the food doing to the other kids? How much of the behavioral issues that we're seeing are just food? It's just the kids that are chronically eating this stuff and their bodies can't handle it and they're screaming and they can't focus. Of course, it's not just that, but how much of it is just that, and how much of it would be solved or improved by just getting kids the food that they deserve to have? And it's so difficult to talk about this now because it's like, oh, well, then not everyone can afford good food. There isn't good food available. But that is something that we need to fight for. Every kid deserves to have healthy food. Every kid should have healthy food. And it's possible for us to do that if we make it a priority. It doesn't mean that we have to get rid of all the corn or get rid of all the snacks, but we can focus on building gardens over the next decade or two. We can focus on making sure that every community has access to better food. That's something we can do if we prioritize it.
Why do you think for a country that spends so much on healthcare, like essentially like they're funneling money there, we have one of the most broken healthcare systems, and we're not prioritizing the baseline things such as nutrition, and is it all the money's going into vaccine research, or what is it? Because things are not improving and kids are only getting sicker, and the average American, is only getting sicker. So where is the resources going?
I think that we're so entrenched with big corporations at this point that it's just so difficult to kind of piece this together. Everybody has their own personal interests and their own corporate interests, and they have so much money that they're even bigger than government in some cases. And so they have just so much control, and they lobby, and they know how to do it. They have the best lawyers, they have the best scientists, they know how to pick and choose the research that's going to point to whatever they want it to say. And the corporation's job is to make money. That's their job, right? Yeah. It's like you can't get mad at a corporation for wanting to make money. That's literally the CEO's job. If he doesn't make more money this quarter than last quarter, he's going to be fired. Their job is not to make you healthy. If that's a byproduct, great, but they don't really care, nor is that their job to care, because the systems that are supposed to keep them in check are gone, or very mild at this point, because they're so owned by these companies. I mean, you talk about the groups that are supposed to police these other groups, they're paid for mostly from those companies. They know how to lobby. They know how to lobby the scientists. They know how to lobby the government. They're not necessarily nefarious. Sometimes they probably are, but for the most part, they just want you to buy their product. And it's really hard to speak out against it, because as soon as you do, then if somebody's big enough and they say anything out loud, then the corporations say, oh, this person's talking about this thing. That's not good for us. Let's make them look crazy.
Yeah.
And it's not very hard to do that.
Yeah. Censorship them, call them names, make sure you discredit them, and, on and on and on it goes. I think the biggest mistake we've done in the US is allowed big corporations to bleed into our governmental systems and essentially own the politicians. Mm-hmm. And until we take the two apart, I don't see how things can get better, because the lobbies outweigh values.
I agree. I think that if we want to have a country that we're going to move back in a different direction. You're going to have to take the money out of politics. It's possible to do it, but there's no possible way you're going to have a unbiased news if the news is owned by Pfizer, right?
Yeah.
There's no way you're going to have an unbiased news if the big food companies pay them hundreds of millions and billions and trillions of dollars, or if
Right.
they run the campaign of a politician. It's not necessarily the politicians doing anything nefariously. They probably don't even understand the science half the time, but they don't care. They're like, oh, this company gives me $100 million. Great. Okay, well, they're telling me their science. They did the science study at Stanford and Harvard. It looks great, and it shows these results. All right, well, I guess we'll do that then. And there's nobody questioning that that study was also paid for by the same company and shows what they wanted it to show. And so this continues on, and it's really hard to fight up against a big machine like that. And then, you can sue them, you can do whatever you want, but they have all the money in the world, and it takes 10 years, and they just switch products anyways, like glyphosate. It's like,
Right.
you could sue them for however many years, and eventually, okay, you win. That's one product. They're just going to put another one.
Yeah.
They know. They don't care. And even if they do get sued and they lose, they still made more money.
I think it's going to have to be the everyday American citizen who's going to have to say enough is enough.
Mm-hmm.
We don't want to live like this anymore. We care about the health of our children. We care about our health. We care about bodies. We want to live better. We want to live without disease. And until we demand that as Americans, it's not going to happen for us.
Correct, because it has to be a massive wave, and that's a very difficult thing to do, especially when you're going up against big companies that have a lot of money that can see where you're going and then spend as much money as they want to shift the narrative to whatever direction they want, or to shift people to fight against each other, which I think we're seeing a lot of these days. Is we fight against each other when really we have so much in common, and everybody has the same goal, which is healthy kids, but we fight over all these extraneous things and then forget who the actual enemy is, which we're seeing it just over
And over. I mean, well, this election especially, we're going to see it. I think baseline, everybody wants the same stuff, but they're at each other's throats for slight little details. And it's like, at the end of the day, if you don't have healthy children, you don't have a future in this country, because the children are the future.
Right. And you should be able to ask questions about everything. I mean, vaccines is the perfect topic for that. There is no reason why we should be able to talk about it. You say the word and you get shut down on social media. You get, yelled at, you get called names. And there are very, very few people that I know or take care of that are anti-vax. They have questions. They want to talk about it. They don't want to put something in their body unless they discuss it. They don't trust a big company with immunity to say, oh yeah, these things are good for me. I'm sure their research is perfect, and I'm sure they have no reason to lie about anything, and I'm sure they have no reason to not say their product is better than it is or minimize the risk. Like, it doesn't make any sense. Of course they do, and of course we have to push back and say, look, everybody wants the same thing at the end of the day. We want healthy kids. We might not agree on how to get there, but we have the same goal, and the way that we get there is by questioning things and having discussions and having debates and letting the best information win and keep studying and researching things. But if you shut down the conversation, then you can never get better, because it doesn't matter what you think. You could be right, you could be wrong, but if we can have discussions about it, then we can push back and say, well, maybe this doesn't make sense. Maybe this chemical is not so good. Maybe we can improve it. That, like, even if you're full hardcore, I love vaccines and the best thing in the world, doesn't mean that you wouldn't say, well, if there's a chemical in there that's causing side effects, I wouldn't want to get that chemical out. Or maybe there is something we can do with this to improve its efficacy. Like, why would we not want to do that? And the world's changed. There are many shots that we give for things that we don't have that much of anymore. So where is the discussion around, oh, well, maybe we could remove this one. Maybe we don't need this one as much. Maybe we could decrease it. Like, these are all, I don't know the answer to the questions, but if we don't ask the questions, we're just doing more and more and
There's
more
not
and
enough
more.
research going on in to see, okay, this is done for, why don't we swap it out? Or
Right. I mean, well, why would the company do that? Right? Why would a company find problems with their product? Right? They're not going to do that. And they're not going to find a reason to take their product off the market. That has to be everybody else. And that doesn't mean that you have to say, oh, I never want to do a vaccine again, right? That just means we could have conscious, reasonable debate to figure out what is the best thing moving forward. But there's very little circular motion on that. It's like just one side, everything else is divisive. And anybody says anything, oh, you're anti this and we should never talk about it again. And that's not where most people are. Most people are in the middle, and they want to do what's best for their child, and they want to prevent a disease if they're going to have that disease prevented, but they also don't want a side effect. And when you talk about things long term in terms of the side effects, there is almost no research on any of that.
Right.
And you can't say something is safe unless you prove it. And why don't we do that for our kids? If we're going to give 50, 70 of whatever, if we're going to make more, we're going to make new ones, why don't we want it to be as safe as possible?
Right.
Most people, if you give them a magic pill that says you are never going to get a disease and this is going to have no side effects, you would happily give that to your kid. But if the thing you're giving to your kid has a 1 out of a million chance of helping you, but a 1 out of 10 chance to give you a side effect, you're probably not going to want to take that pill. So if we don't have the research and the data long term, then how do we know what's going on? Because there's so much chronic disease, and how do we know what part of that has to do with shots? You can't say you don't develop cancer in 20 years from whatever if you don't study something for 20 years. If eczema's on the rise, ADHD, all these conditions, then is it related? You can't necessarily say it caused it. I've seen kids with autism that never took a shot. So people are like, oh, it's the vaccines. Well, I've seen kids that never took a vaccine that got autism. So that's not it. It has to be bigger than that. We have to discuss what is involved and what are the factors, right? And if we do that, then we can help our kids be healthier. And maybe that's going to mean changing things, or maybe it's not.
This episode is brought to you by Biooptimizers. Are you tired of tossing and turning at night, unable to quiet your racing mind? 4 out of 5 Americans aren't getting enough magnesium, and it's affecting their sleep and overall well-being. I used to lie awake for hours worrying about my to-do list for the next day. It was a vicious cycle that left me exhausted and unproductive. That all changed when I discovered Magnesium Breakthrough. Since adding it to my nightly routine, I've been falling asleep much faster, staying asleep much longer, and waking up refreshed. It's been a game changer for my sleep quality and energy levels. What sets Magnesium Breakthrough apart is its unique blend of all 7 forms of magnesium. Unlike other supplements that offer just 1 or 2 types, this comprehensive formula supports everything from stress management to muscle recovery. Experience the power of optimal magnesium levels for yourself. Go to biooptimizers.com/biohack-it and use promo code Biohack-it to save 10% on your first order. Subscribe for even bigger discounts and free gifts, ensuring your monthly supply is always guaranteed. Don't let sleepless nights hold you back. I forgot the amount of vaccines that have been added, but I was born like 1983, right? So I'm 41. How many vaccines were on the schedule then versus today, 2024?
So back then there was like, depending on what year, like 3, and then there was like 7 or 10.
Yeah,
so it's like not that many back then. And then now it's kind of hard because there's a bunch of new ones and it depends how many times you get them.
Yeah.
But there's somewhere between 50 and 75.
But isn't that crazy? Like they were flooding children's immune systems, like badgering them with this like pharmaceutical drugs from such a young age,
right?
And labeling them as safe vaccines.
Well, and that's the debate, right? Because the counter argument to that is we have a lot of diseases that we had, and we created these things, and now we don't see a lot of these diseases anymore, and so they give you some protection. So it's a balance between those two things, right? What are the benefits, and what are the risks? And we hear a lot of talk about the benefits, and I think that we don't have all the true discussion about the actual benefits, or whether some things are not really around or whether some things are really needed, like for example hepatitis B at birth. I think there's just so much discussion even on that shot from rational pediatricians. They're like, well, we have testing now, right? We have testing for Bob's for hepatitis B. So
correct.
While
so why
there's
are you
a
giving it? Yeah.
theoretical risk that a baby could bang into a needle or have a crazy baby party, that the risk is like really zero, or not zero, but like very, very low. And I've heard people talk about this before, and I've asked the question too, like, is there evidence that babies have actually been exposed when they're 6 months or a year? Like, is there a lot of cases of that? I haven't found it. So yes, it makes sense if you don't know the mom's status and maybe they're a drug user, homeless, and they don't know what their status is. But the average mom is tested now. So do we have to give that on day 1 of life or day 2 of life? Where's the discussion on that? Like, that just seems to me that there are obvious ways that we could minimize. Doesn't mean you never get hepatitis B vaccine, but maybe we don't do it on day 1 for a baby that has no risk to get it. So I just think that there are discussions that have to be had, that we can have it without saying, we're not going to do this anymore. These are bad. These are good. It's not bad or good. It's risk versus benefits. And that is the way that everything is done in medicine. You don't go into a elective surgery on your heart without discussing with the surgeon, okay, well, here are your risk of dying, here's your risk of getting blood clots, here's your risk of this, this, and this, but we think you need to do it because it's going to benefit you and we're going to give you another 10 years of life, whatever that is. That is the way that everything else is done in medicine, but with vaccines especially, it's like, yeah, do it.
Isn't there what in the first what's the current 2024 schedule for the first 10 days of life, first 3 months, first 6 months?
So when you're in the hospital, you're offered the vitamin K shot and the hepatitis B shot, as well as the antibiotic eye ointment. So those would be your newborn.
And how much of those are actually vitamin K? I've heard, and the ointment I've heard a lot of controversy about as well.
So I would say the least controversial of all the shots is probably vitamin K, if there's least controversial, because there certainly is a real benefit from vitamin K. So when you're born, you don't have a lot of vitamin K, and vitamin K helps you with clotting, and you usually get it as you start eating, and you get some in the food, and your body makes it. But when you're first born, you don't have a lot. So if you had a very traumatic birth, or for whatever reason you're not clotting well, you can have a bleed, and if that happens in your brain or in your gut, that's pretty severe, and you might not catch it till it's too late. And so while the risk was not very high, like maybe 1 in 10,000, if it happens to you and happens to your kid, it's a big deal. They could die, they could have severe brain damage. And so they invented the vitamin K shot to decrease that risk. It basically brings it down to 0. And so there's a real benefit there. Even though the risk is very small for your child, unless they have a severely traumatic illness, there's a real benefit. And the risk is on the smaller end because it's a vitamin as opposed to some of the other stuff. There's still chemicals and preservatives in there. But lower risk, I would say, than some of the other stuff. So that, I think, is the toughest decision for most parents when it comes to shots, especially if they're naturally minded, because you can kind of see the pros and the cons there, and there's some good discussion. And the long-term risk is probably pretty small, but who knows? That's a whole other discussion for maybe another question. But so then there's the hepatitis B, and then the regular schedule at 2 months, you have, if you're doing single shots, there's combo shots, but there's the whooping cough shot, so it's the DTaP, diphtheria, tetanus, pertussis.
That's the one that we all have a little mark from, right, as kids sometimes?
Maybe, yeah, if you got that one. And then there's so there's hepatitis B, Haemophilus influenza, polio, pneumococcus. Those are your child ones. You do those at 2, 4, and 6 months in general, and then there's measles and chickenpox as you get older. So depending on how you're doing your schedule, which shots you're getting, they might differ a little bit, but that's kind of how it is. And there's combo shots. You don't have to get like 6 pokes, but a bunch of them come in one. And then there's also the RSV shot, which is new, and the flu shot, and the COVID shot. So there's a lot of new options of things that you can give children on top of that. And that's where, again, it's like, this is a very difficult conversation for me, because now there's just so many shots you can give your kid in the first couple of months. And it's like, okay. And again, like RSV shot, like, of all the shots that are new, that one makes some sense. Like, RSV does kill kids, and you do see kids get pretty sick with that one. So interesting, but again, that one was kind of rushed out in my opinion, and there are some theoretical side effects. But I mean, I know lots of kids that have severe RSV, so that is a reasonable thing potentially to add on.
And for somebody listening who doesn't know what RSV is, can we explain that to them?
Yeah, so RSV is respiratory syncytial virus. It's one of the viruses that kids get, and it is a very common kid virus. So 90% of kids have it by the time they're 2. Usually when you get it, it's a cold. You're totally fine. And you get better after a couple of days. Maybe it's a bad cough, or you have a cough for a couple of weeks. But for some kids, you can get really bad where they have especially for babies, you can have significant trouble breathing, could put you in the hospital, could put you on a ventilator, could put you, kids die from it too. So when I worked in the hospital, if you saw a young baby with a respiratory virus who was in the intensive care unit, that would have been one of the most common causes. So is it something you should be afraid of as a parent? No. Again, every kid has it. So just that if it gets bad, that's one of the ones that tends to get bad. So to me, if you're going to have a treatment for something or prevention for something, that's a reasonable thing to think about, because a lot of kids get it and it could get very severe. Now, again, should you do it or not comes down to risk versus benefits. What are our risks of getting RSV? If you do get it, what's your risk of dying or ending up in the hospital versus what is your risk of getting a complication from the vaccine, and what's your risk of getting a long-term complication? And the only information we have on that, or pretty much any shot, is what the company did for a couple of days or couple of weeks, couple of months, and what they say is the research and the data, how they've synthesized it. And of course they say benefits outweigh the risks, but you
Right.
don't know anything long term. And you usually have not the biggest even sample sizes for those things.
And talking about sample sizes and like not having enough research and data, right? Is it true that now the new schedule that they released is that a kid under 9 months should have 3 COVID vaccine jabs?
Theoretically.
But so this, the vaccine was rolled out, in my opinion, in such a rush to begin with. They don't have long-term studies on the effects that it has on children and development and things like that. So how would they be able to get approved such an aggressive vaccine? That's pretty aggressive.
So it's approved based on the research and the consensus of the people that decide these things, right? And there's not a lot of research. There's certainly not a lot of research on kids.
Because they're hard to study, and obviously
They're hard to study.
get-
Most people are not putting their, but people do. People put their kids into studies. I think, look, at the end of the day, the only thing that can be recommended technically is what the CDC recommends, because that's what they have studied and that's what they've decided. If people want to do something different, then that's where you have to talk to your practitioners, read about things, research, and think about what's best for you. I can never make it, I can't give medical advice to people, and I certainly can't tell people what to do, and I never would. And certainly not on a podcast or a show or anything like that. But I think that when you're talking about this topic, it was very interesting to live through. Interesting, maybe not the right word, but interesting to live through watching a new shot come on the market, watching a disease kind of work its way through, and watching a discussion about safety on something that you cannot say is safe. Like, that was one of the most crazy things to me in the entire pandemic, was saying something was safe when you can't possibly say that. You can say, based on the research that we have thus far, the benefits seem to outweigh the risks. That could be correct, right? You can debate whether that's true or not for that shot, but you can say the benefits seem to outweigh the risks. We're going to decrease your risk of dying and severe disease, but here are your risks that we know so far. But you cannot say it's safe long term when something's new. How could you say that? You can't know that we're not all going to grow a third arm in 10 years if you take something, if it hasn't been 10 years.
Or cancer rates are going to go up.
And you don't need to. Like, you don't need to lie about that. You need to be honest with people so that they can make a decision and weigh the pros and the cons for them and their family. And what we have seen from this is hesitancy in medicine, and like hatred of doctors and the medical system in general has gone through the roof because nobody trusts the medical system anymore,
Right.
because they've been lied to and so obviously just kind of deceived with these things. And you're like, and I have more parents than ever coming to the office and saying like, well, we used to do this, or we used to get shots. I don't want to do anything anymore. I don't trust anything. That's terrible. Doctors used to be one of the most trusted professionals. Healthcare medicine used to be one of the most trusted professions. And now the vaccine hesitancy rates are higher across the country than they've ever been before. People are pulling their kids out of school at rates that they've never done before. Like, look in California, like the rates of homeschooling is through the roof.
Yeah, I had dinner with somebody last night, and I was like, "You're homeschooling your kid?" She's like, "I feel safer with her in the house." And this woman could afford to send her kid to any school she wanted, but she's like, "No, I'd rather have her at home."
Right, and that is terrible. That's a failure of healthcare and professionals to be honest with patients. We're on the same team, and you don't have to have all of the research on something new to say, well, we recommend this based on what we know, but of course we don't know the future, and so we're recommending it because we think it's going to help you today, but there's always a risk that something could get. Like, that's a reasonable answer, and people will decide to do it or not do it depending on the information that we have. We don't have to lie to people, but I think there's this like push for like, this is the only way, and if we don't do it, then people are never going to do something. And that's not true. People will still get shots if we have discussions, and I think more people will if we have open, honest discussions and we make them as good as we can and make them as safe as we can and do really large studies that show that they are safe and effective. And if they aren't, if the big studies that are done properly show that there are problems, then let's fix them. Let's do something about that. Like, if they are contributing to eczema, if they are contributing to allergies, if they are contributing to autoimmune conditions, let's figure out why. It doesn't mean you have to stop doing it, but maybe there's something in there that could be changed.
Right.
Maybe the dosing could be changed. Maybe the schedule could be changed. I don't know. I don't know the answers to these questions.
Yeah.
But if we ask the questions, we can have healthier kids, theoretically, right? Or you will find that they're perfectly safe and amazingly effective, and we can prove that, and then people won't be hesitant to get them.
Right. It's a win-win regardless. If you
Either
look at
way,
it from
right?
that perspective.
You're not lying to people. That's it.
What's your take on, and you have 2 little kids of your own, what is your take on screen time? Because a lot of people just like shove a screen in front of their children. What are you seeing and what do you advise? Not only in your own family do you practice, but also advise patients. This episode is brought to you by Timeline Nutrition. Are you ready to unlock the secret to boundless energy and vibrant health, no matter your age? Imagine your body as a bustling city with trillions of tiny power plants. Your mitochondria working tirelessly to keep you alive and thriving. But here's the catch. These cellular powerhouses are under constant attack from modern life's invisible enemies, toxins, processed food, and polluted air. As we age, our once effective cellular recycling system starts to slow down, leaving us feeling drained. Enter MitoPure, your cellular fountain of youth. This isn't just another supplement. It's a scientifically backed revolution in a bottle. MitoPure doesn't just mask symptoms, it dives deep into your cells, clearing out the cellular clutter and making room for vibrant, energetic newcomers. Imagine recapturing that youthful spark, the boundless energy, the quick recovery, the mental clarity. That's the MitoPure promise. It's not just about adding years to your life, but life to your years. Don't let another day pass feeling less than your best. Rejuvenate your cells, reclaim your vitality, and age with MitoPure. Visit timeline.com/biohack-it now and use my exclusive code Biohack-it. Your future self will thank you.
Well, so there's 2 different age ranges for screen time. And I am so happy that we're talking about screen time more now. I think Jonathan Haidt's book was such a great thing this year in terms of bringing this discussion to the forefront, because it really has gotten to the point where it's a big problem. For younger kids, the recommendations are 0 screen time between the ages of 0 and 2. That's the American Academy recommendations. I don't think that's very reasonable for most parents. I think it just stresses them out. I would just say minimize using screen times as much as possible. I every so often get a parent who comes to the office and they say, oh, our toddler was watching whatever show, and then I didn't realize that my baby was watching it for a couple of minutes, and now I'm so worried I've ruined their brain. No, come on, that's not true. Watching a screen is not going to ruin their brain. We have enough things to stress about. You don't need to stress about that. What concerns me is the amount of screen time that we're using that's just increasing and increasing and increasing. The teens now 7 to 9 hours average screen time a day. That's insane. It's what we're not doing that's important. They're not getting outside. They're not spending time with family. They're not cooking. They're not getting out in nature.
They're not reading either.
All those things, right? And the screen by nature is not the problem. I think it's how we're using it and what we're not doing. I think it's okay to do your homework on a screen. It's okay to watch TV every now and again. We all did. It's okay to watch a screen if you're on a long trip and you're on a plane and instead of having a tantrum, your kid's gonna watch a cartoon for a couple hours. I don't think you should plop it in front of them for 3 hours straight, but I think it's a good tool to have that you can use every now and again. And to me, I'm much more focused on getting those 7 to 9 hours down to a more reasonable amount than worrying about the 5 minutes of your kid being on a screen. If you want to go to the mountains and never put your kid on screens, that's fine. It's probably good, but that's not realistic in the real world. So I'm not so worried about a couple of minutes, and I don't think parents need to be super stressed about that. I think minimizing it and trying to make it educational, especially for the younger kids, that's okay. There's a ton of research for kid shows like Sesame Street that it's good for them.
Right.
That it's actually educational.
It helps them develop their brain and all that stuff.
It's just that when you look at the research, it shows that it's not as good as active participation. It's not as good learning to read as a person doing it with them. Doesn't mean you can't learn, just means that you shouldn't plop in front of the screen all day.
Right. The big thing I've seen I was actually at dinner with somebody who's like a Gen Z, and she actually brought it up. The more we have actively gone into screens, the less and less, we're reading and improving our vocabulary and stuff. So if you look at our generation, that's obviously a little bit older, and then you look people in their early 20s and teens, we have such a vast vocabulary because we were still the generation that read a lot and all of that stuff and exercised their brain, versus the younger generation. And this was a Gen Z telling me this. She's like, when I hear my peers speaking, they speak more eloquently, they speak in bigger sentences, they have a better grasp of grammar and language than sometimes the younger generation. I think it's down to how much time they're spending getting news bites and dopamine hits from social media versus picking up a book and reading it, or even reading the newspaper. They don't read the news anymore.
Yeah, I agree.
So
totally.
the development obviously must be, completely impacted because their brain's not being exercised.
I think so. I mean, all the research I've ever seen agrees with that. I think that kids need that active communication. Nothing replaces family. Nothing replaces love. Nothing replaces reading a book every night. You can put your kid in front of a screen, but at the end of the day, it's passive, and you're not always controlling what they're watching. And so I think that, you can talk about social media, it's a whole other topic, but just from a learning perspective, just from a developmental perspective, it's nowhere near as good, and it's an easy thing to do, to kind of plop our kid in front of the screen. But I don't think parents should be stressed if they do it every now and again. If they do it for a couple of minutes, that's not the problem. It doesn't turn your brain to mush. Not in a couple of minutes. That's not what I'm worried about. And
it's a long-term usage.
Exactly. And I think that's true of most things. It's, what are the chemicals that we're being exposed to? It's not one piece of cake. It's all the food. It's all the screen time. It's all the non-movement. These are the things that add up.
And slowly are impacting development and behavioral patterns. So I wanted to ask you about, I see a family practitioner because I'm doing this detox protocol in New Jersey. She's really wonderful, Dr. Christine Gator Warsh. So she sees like young children as well who have had mold exposure or going through like Lyme or something like that to treat them. So I was talking to her, as my husband and I plan to have a family, and she said, there's a book that she read. She had to actually give it to me. I don't remember the name right now though, but it was about how everyone's teeth were perfect until sugar got introduced into all the diets, and then you saw teeth erosion and formation. And in that book, she talks about how you should not give she has 3 sons now. One's 21 and the other 2 in their teens. So she got exposed to this book probably by the time her oldest was 2 years old. And it's about that, do not give your children any sugar, any form of sugar, till they break their molars. And I was like, really? And she said, listen, I didn't do that with my oldest, and I did that with my younger 2, and they're grown men now, grown boys now. And she said, my younger 2 have not been sick a day in their life. She's like, when I tell you, and she's, traditional MD, she said they've never been sick. And my older one still gets it off, like he has allergies or flu here and there, but the younger 2 never.
Well, I don't know about the tooth part.
Yeah.
The sugar part, I agree with. The tooth part, I feel like, I don't know. We only see what we see in movies and TV. I feel like people didn't have the best teeth back in the day, but I don't know.
Yeah.
I don't know about that part.
I have to get the book and send it to you. Yeah.
Interesting theory. But I totally agree with the sugar part. Well, first of all, I think it's really important to break down sugar by natural sugar versus added and processed sugar. I don't think there's a huge issue with honey and maple syrup and sugar and fruits and vegetables and things like that. I think that's fine, and that's always been around. It's really the processed added sugar that we are giving our kids that, it's just so beyond what our bodies are able to handle. I mean, of course, you hear sugar, and then of course everyone starts to fight about it. Of course, sugar is not bad in and of itself. We need sugar. It fuels our brain, right? So it's not a bad thing in and of itself. It's the type of sugar that we're getting, the quantity. I mean, most kids get more sugar in a week than you need in a whole year. Most kids get more sugar by the time they're 5-10 years old than we had in our whole lives before, and most of it is crappy processed sugar. So I think we need to focus on getting, at home you shouldn't add sugar to almost anything. There's no reason. And if you're going to, it should be like an actual, like a coconut sugar or honey or maple syrup or something that's a natural sugar, so your body can break it down and knows what it is. And that way you're at least minimizing it, because we're going to get enough sugar anyways. So to me, that's a reasonable, common sense way to go about things. And most of what I try to talk about is, it's very stressful for a parent these days, and it's very easy to be overwhelmed and say, oh, well, everything's toxic, everything's horrible, all the food's bad for me, what am I going to do? But I really want to try to give actionable, reasonable tips for things that people can actually do at home in the long run. And so I think something like that where, you don't have to demonize all the sugar, but I think if we could be very mindful at home to not give any added sugar, because it's probably really bad for you. I think we have very good evidence of that at this point, even though there's still pushback on that. And so that's a really easy thing when you're cooking, to just not add that kind of sugar. Just don't buy it, don't have it at home, and read the labels. Read the labels on everything. And if it has a lot of processed added sugar, don't buy that thing. Buy the other thing. You don't have to go from chips to broccoli. Right. You could just read the 2 bag of chips and buy the better one.
Right. And that's a really important thing. There's always alternatives to healthy snacks. And just because something's named or labeled healthy in the food aisle, at Whole Foods even, make sure you pick up the bag and check the ingredients. A lot of the stuff that they market as healthy is like full of seed oils. So it's really up to parents to do their own research and understand when grocery shopping to check ingredients?
Yeah, I get asked all the time, like, what is the one thing that I would recommend if a parent was to start doing something today? And to me, it's reading labels, because that's going to give you the most bang for your buck. First of all, try to buy things without labels, but if you're going to buy things with labels, which we are, then turn it over from now on, read the label and everything. You don't need a degree to know that some long chemical word's probably not good for you. If you don't know what the word is, don't buy that thing.
Yeah.
If
It
you
should be in your body.
Right, it should be in your body. It's great if you can start learning about things over time, and most people do, because they read a label like, oh, I don't know what that thing is, and then they learn about, like, what, really? Why would I want to eat that? And your kids, if you're a parent, start to see you doing this, and then you're imparting on them to learn about reading about things and learning about what you're putting in your body, so that way you can be a mindful consumer, because our job is not to force them to eat healthy, air quotes, it's to teach them about health and impart these skills upon them, so that way when they go out in the world, they also read labels. And I think the realistic way that we're going to see it change is if people stop buying crap. And if people stop buying crap, then the companies will change what they sell
Right.
to have
Supply
better
and
products.
demand.
And that's the only way it's going to change. I mean, I hope that we can push back and we'll have some legislation, and maybe that'll happen, maybe. But at least in the short term, it's only going to change from the parents.
And what is your take on like vitamins and supplements for children? And if yes, what age? Like,
So, yeah, I get asked that a lot. And my opinion on it is that we should get our nutrition from food. That is the goal. That's the way that we should get all of our nutrients. The reality of the world is most kids don't eat very well. Most adults don't eat very well. We have crappy diets. We don't get enough sunlight. And so if you are deficient, then I think it's reasonable to take some supplements some of the time to boost things up. But ideally, you work on buying healthier, fresher food, and you're going to get your nutrients through that over time. So sure, if you want to get some supplements, I think that's fine. If you want to get a multivitamin or an omega or a probiotic or vitamin C, elderberry, like there are a lot of supplements out there that have some pretty good research that they can be supportive. And certainly if you're sick or have things going on, that's a good time in general to use these things. But the goal shouldn't be to give your kid a multivitamin so they have their nutrients. Your goal should be to get them the food so they have their nutrients.
and this just builds their immune system. On
Right.
top.
If you have a picky eater, okay, fine. A multivitamin is not unreasonable, but I promise you a multivitamin is 1/1,000,000th as good as getting those same nutrients from food. It's still a synthetic chemically thing. I mean, it's the best that we have, but still a supplement.
And what about I know everybody listening is like, hey, you're speaking to an amazing pediatrician. You need to ask him. Kids are going back to school. A lot of people's kids get colds. What is your favorite, and what do you do with your kids when it comes to a cold? Because people are just giving their kids Tylenol or whatever. Like, what is the...
Yeah, I mean, I try to minimize medications as much as possible. I'm not sure kids have ever had Tylenol, but I'm not like against it if you really need it. I think that immune supports are great. So vitamin C has a lot of evidence. Vitamin D has a lot of evidence. Elderberry has a lot of evidence. A multivitamin has a lot of evidence. Zinc. I mean, these are the things that really have some quality evidence that they're supportive of the immune system, that they decrease your length of time having a virus. Not a lot, but there's some evidence that it helps a little bit. And there are a lot of great immune support blends out there and things like that. So to me, what we really try to do is you want to eat healthy, especially before you're going back to school. Make sure you're not having a lot of sugar. Make sure you're eating healthy.
Right.
Get your sunlight. Get outside.
Sleep.
Get moving. Get their sleep. Try to minimize your stress. I mean, that's what's truly going to prevent you from getting sick or minimize your risk. And your goal is not to stop all sickness. I mean, kids are going to get sick, and that's a normal part of the day. Your job is to help them to be resilient, so when they do get sick, it's minimal.
Right.
And their bodies can bounce back. And if you want to do some supplements, I think that's a reasonable time going back to school, because everybody's sick when they go back to school. But ideally, you're really focused for that week or two before on, like, we got to be really healthy. We got to eat healthy. We're not going to have a lot of sugar. We're not going to have a lot of treats, because you're going to be exposed to a ton of viruses at school. And if you're not at your very best, you're for sure going to get sick.
Right. And what's your take on probiotics for children? Because it's seeming to become a really big, like, popular topic. So I'm just wondering.
Yeah, I think parents sometimes come to me like, should I just give my kid probiotics? I don't think so. I think that you shouldn't give anything just because. We have no idea in 10 years, we're going to come back like, I can't believe we're doing those probiotics. Oh, I can't believe
Yeah.
that strain. We don't know how things affect anything. And so it's really simplistic to say, oh, we're going to give you these good bacteria, we're going to throw them in your gut, and that's going to make everything better. Is there some good evidence that they can be helpful? Sure, there is. But if you have a healthy child who's eating well and doing well, I don't want them on probiotics. I think that there's no need for that. If you have issues like constipation, diarrhea, bloating, stomach, sure, that's a reasonable thing to start as opposed to medication. But not just because.
I think this has been so educational, at least for me, right? To speak to an actual, pediatrician, talk to him about how you're like seeing patients coming in, raising your own 2 kids, what's kind of the things to watch out for, toxins, really to build healthy, safe children, which is essentially what we should all be interested in. I think you're even in the mind to procreate and have a child. Should be the number one discussion you even have with a partner. Mm-hmm. How do you want to share the responsibility? What are you okay with? What are you not okay with? At least we started to do that in our household.
Yeah.
I wanted to ask you, Dr. Joel, because you had such great experience in all the years that you've been seeing things, whether it's research or speaking to people. What is the one thing that's probably shocked you the most, like, right now in your career? Like, you're actually mind blown and being like, I cannot believe that all the data and research suggests X, but we're still doing Y.
The thing that shocks me the most is the arguing and fighting out there on social media and the lack of ability to discuss topics that should be very obvious that a pediatrician should be able to talk about, like obesity and vaccines and development, like just topics that you would never imagine would be so controversial to even have a discussion about, that you don't feel comfortable talking about it.
Right, because of being bullied or censored or...
You're just worried about being censored, losing your,
license.
Losing your license, getting into fight. I mean, it's if we're talking about vaccines, it's like, why can't we talk about it? You don't, if you're going to be out there and be like, oh, all vaccines are the worst thing ever and you should never get a vaccine or whatever, like, I can understand why people could get mad at that. I understand people have different views, so everyone has different views. But my point is, if you can't even talk about it, even if your point of view is we should all get them, we should do it, they're the best thing in the world, we should talk about that. We should have a debate about that, and so people that don't feel that way can say why they don't feel that way, and then you should be able to prove why you think that way.
I feel that in everything nowadays, though. You have a differing opinion to somebody. There's no room for debate, I think, left currently in America. It's like people have become highly intolerant and they don't want to hear your opinion if it does not sit aligned with what their priorities are or their values are. And then they try to label you and put you into a box because they don't know where to place you. So they're like, we're going to label this person with something negative, put them in a box and just leave them there to deal with, versus being open to being like, the freedom of speech is our First Amendment, is to be like, you should speak, I should speak, our neighbor can speak, and we can all disagree, but everybody gets a turn to speak and be who they want to be, because that's what our ancestors fought for, right?
I know. The labeling is insane. I mean, it's really funny to me online, especially that people are like, oh, not everybody, but like, oh, you're anti-vax, oh, you're Republican, oh, you're this. And I'm like, first of all, I'm Canadian, so I can't even vote. Number one. Number two, I don't identify perfectly with either side. It's somewhere in the middle, because you don't identify with the side, you identify with items and discussions. And at the end of the day, it's debate and discussion that
makes
matters.
better. Yeah, it makes
and there's no side. Like, I mean, it's been amazing to me as I've gone through my book tour, how many, quote unquote liberal things won't have me on, just because I would be willing to talk about being open about having discussions, versus things on the right that are more. And I'm like, what does it matter? There's no side. I'm talking about kids. There's no politics. I will go on everything and anything that will talk to me, because we're here to educate about the discussion. There's no side to kids' health. It's ridiculous.
Can we tell everybody a little bit quickly about your book that you've given me that I'm excited to read? It's Parenting at Your Child's Pace, the Integrative Pediatrician's Guide to the First 3 Years.
Yeah, so it's a parenting book for the first 3 years. I really wanted to write a book that targeted that age range, because I felt like most pediatrician books are now about health and cough, colds, runny noses, but there's not a lot of parenting books written by pediatricians. Right. It's mostly therapists, and the health epidemic is such a big issue that we need a parenting book that goes through those big questions, but discusses health. And the book starts by talking about health, and I think it needs to be foundational. And one of the reasons I got into pediatrics was to get ahead of disease, was to prevent things. And so I wanted to talk to parents from day one, while they're pregnant, before they have kids, so they can set up those foundations to have a healthy child, not to see me 10 years later when they have an illness.
Amazing. And where can people find you on social media? I mean, I found you on Instagram, but
Instagram or X at Dr. Joel Gator, or they can find the book Parenting at Your Child's Pace, all the normal places, Amazon, or parentingatyourchildspace.com.
I think anybody who's planning to have a family, has a family, or just wants to learn more definitely needs to follow you. Thank you so much for taking out the time to see me and come into Biohack-it.
Thanks for having me on.
Thank you.